Welcome everyone. Now let us start with the most important topic of dermatology. This is one of the star topics that is exclusively being learned in dermatology, right? That is psoriasis. So first of all, we'll just start with the types of psoriasis which are there, and we'll just try to then go on with the presentation. We'll see some images and then followed by the treatment and what options do we have to offer the patient. Alright, so first of all, this is an autoimmune inflammatory skin reaction, right? So let us first of all just see what are the types of psoriasis we have. Alright, so let us just begin. Psoriasis, right? So one of the type is where there is a lot of pus involved, right? So it's called as pustular psoriasis. And in this pustular psoriasis, we have more two types. Yes, so the first one is the palmoplantar type. Let me just write it down. Palmoplantar type. Okay, and the next one is something which is similar to that, but it is very severe, where the whole body is being covered in pus, right? So this reaction is specifically known as a von Sombos reaction. Von Sombos reaction, yes, in which we have there is a sea of pus appearance, right? And just after this next, when we are done with the classification, we will go on and see some images. Von Sombos reaction, which is sea of pus. Alright, so that is all for the pustular psoriasis as of now, and now let us continue with the next type, that is guttate psoriasis. Yes, guttate psoriasis. This is a very classical type, yes, in which the lesions are almost like there is some raindrop on the skin, right? So the highlight word for the guttate psoriasis is going to be raindrop lesions. All right, so let me just write that down real quick. Raindrop lesions. Raindrop lesions will be there. Okay, so continuing our list, the next one is going to be the chronic psoriasis. Chronic psoriasis. And also this one, the chronic psoriasis, is also psoriatic vulgaris. Alright, vulgaris means the most common, right? So I'll mention that as well, that this is vulgaris. Yes, and one question to you is where do you usually see the findings in psoriasis? Definitely, as we go ahead with the lecture, we will continue on to see the presentation, right, in the most common one and also the other one, but because the next psoriasis type is actually opposite of what the common variety is, so that's the name actually for that. It is called as inverse psoriasis. Okay, so in chronic psoriasis, that is the vulgaris form, the lesions are on the extensor surfaces. Alright, so on the extensor surface, the lesions are going to be there. Yes, let me just write it there. Extensor surfaces. Okay, and inverse psoriasis, as the name says, inverse, right? It is an inverse finding of anything. Yes, so it is opposite of that, that is, they are found on the flexular surfaces. Flexular surfaces. Alright, so these two were of pustular psoriasis. Alright, so now let us continue and see more different types of psoriasis we have. Alright, one of it is called as guttate psoriasis. Alright, guttate, acute guttate psoriasis. Let's write guttate. Guttate psoriasis. Alright, so the word guttate psoriasis, in this specifically we have the raindrop lesions. Alright, so let me just write that real quick. That is, raindrop lesions are there. Raindrop lesions. Okay, and the next type of psoriasis is, the next one is the most common one. So the word we used for common is vulgaris. Yes, so chronic psoriatic vulgaris. Vulgaris. Okay, fine. And in this, definitely we'll see all the most classical features, right? And just a question to you, that in psoriasis, where do we usually find the lesions? Alright, so it's going to be an extensor surface or the flexular surfaces. Okay, so the answer is we see it on the extensor surfaces. Extensor surface. Right, let's go on to the next type of psoriasis, that is the opposite of what we have now. As we finish this classification, we will also do a revision of the whole thing, and I'll be asking you the questions that which type of psoriasis is this, along with the image. So definitely make sure that you are listening to this. Make sure we just try to remember the names along with me. Okay, so the next one is inverse psoriasis, as we used to learn back in the days in mathematics, right? Inverse of anything. Yes, this is inverse psoriasis. Okay, and in this, as opposite to the vulgaris form, we'll have the lesions on the flexular surfaces. Flexular surfaces. Okay, alright, so continuing our discussion with the types of psoriasis, the next one would be something that is the only emergency in the whole of dermatology, right? And this topic is a star topic, as we know that it is in the dermatology exclusive thing, right? So this is erythrodermic psoriasis. Okay, erythrodermic psoriasis, and this is the only emergency in the whole of dermatology. Yes, okay, let me just write that down. This is the only emergency. Let me also add some tags to this one. Okay, as this is a danger, so we need to add the danger sign. Okay, alright, so we'll see the image as well in the next slide. Okay, the second last variety of psoriasis, that is something called as a nail psoriasis. Alright, in the nail we have some specific findings in this. The next one is one of the last ones, that is arthritis psoriasis, with pretty interesting finding, right? So in something like psoriasis we have and the correlation with arthritis. Yes, so as we go on for the investigation of this patient, do make sure like you just remember this point, that there was arthritis involved, and in arthritis what are the findings we usually see in the patients, right? So keep that point in mind. Now let me just write the next one. This is arthritic psoriasis. Okay, all right, so this whole thing, as you can see over here, this pretty much summarizes everything in psoriasis topic, right? So please try to memorize this. Yes, it does make our life easy, because we have this classification in our head very clearly. We see the image, we see the hot words, the limitless hot words, and then it is pretty easy, right, to go ahead with it. So now then the same classification is being made on the next table, next page as well, right? So this time I'm going to ask you questions after we see the images. All right, so here it is. Okay, so first of all we have psoriasis, right? So what was the first type of psoriasis? We see this was the pustular psoriasis, right? So over here we have the pustular psoriasis. Okay, there were two types, localized and generalized type, palmoplantar type, and the von Zumbusch reaction, that is a generalized skin reaction. Now let us see the images. Very clearly seen, right? On the palms we have psoriasis, and we can see that over here we have this is the normal skin, right? And this is where it's completely affected, right? We definitely see some scaling here. Yes, and why this happens is also we will read in the next one. Okay, let us go on for the next type, that is von Zumbusch type. As you can see in this image, that there is so much of pus, right? There's so much of pus right underneath the skin. Yes, so this is generalized type, and also in this patient, as you can see, there is some bright pus as well. Near the belly we can see some lesions, and the whole body has been involved, right? So this is the generalized type. And let us move on to the next one, that is the plaque psoriasis. Yes, and in this one what do we have? The acute gutted psoriasis. Over here, as you can see, the lesions, right? The lesions are almost like there are some raindrops on the body, right? As you can see, so many different type of lesions are there, right? And this is the acute gutted psoriasis. Okay, the raindrop lesions. The next one, as we said, is chronic plaque psoriasis. This one, yes, as you can see on the extensor surfaces of this patient, we have all these findings. Yes, for sure, if the image was complete on the elbow as well, we could have definitely seen a lot of findings, right? So on the elbows and the knees we usually see the lesion. Okay, all right. The next one was inverse psoriasis. Yes, these were all the flexular surfaces, extensor surfaces, flexular surfaces, right? So on the folding skin foldings, right, we would have this. Yes, as you can see in the image as well, right? Okay, all right, so continuing on with the next one, that was so which was the most dangerous type of psoriasis? We learned that was the only emergency in whole of dermatology, that was erythematous psoriasis, right? And the next one, that is one of the nail findings, right? And let us see the image of the erythematous. We can see that it is so severe, right? And the patient could end up into low output cardiac failure, right, in this condition. Okay, so it's pretty dangerous to have. The next one we see was the nail psoriasis, right? The nail psoriasis, okay, right here. Okay, in the nail psoriasis we see very peculiar findings. Okay, and the next one is the psoriatic arthritis. Yes, this is the last of the classification as psoriatic arthritis. Okay, and let us try to describe this image a little bit more. Yes, something from orthopedics, something from medicine, right? Whenever we have some deviation, we use very specific words for that. Yes, so the two words are valgus and verum, right? So question to you guys, question to the listeners, right? So what is this? Is this valgum or is this varus? So the toe, the great toe, we call it as hallux, right? I hope you guys come to the conclusion that it is valgus or verum, right? Hallux, which one it is? Is it valgus or verum? This is valgus, right? VALGUS, valgus. Why we always get confused in both these terminologies, right? Including me, right? Back in the days, I used to get confused a lot about how to memorize this, right? So let us just break this confusion once and all our lifetime. So let me just draw. Okay, all right. So I could have done a better job at this, but still okay, fine. First of all, we have to see the deviation after the joint. All right. So in terms of knee, in the example of knee, after the knee, where the legs, where the feet is going, right? So if it is right here, right? If it is right here, yes, it is going where? It's going on the lateral side, right? So if it is going on the lateral side, it is going to be valgus. If we see in this image that it is going on the medial side, right, it is going to be varus. Alright, so in this image we come back, the great toe is been pointing outwards. Yes, so after the joint we see that the great toe is pointing outwards. Yes, so it's going to be a valgus. Okay, alright, fine. So this was all about psoriasis and the classification regarding that, right? So now we move on to read about psoriasis as a whole thing. Okay, what are the findings? We all know that this is an inflammatory reaction on the skin, right? And why all the mayhem is actually happening, right? So let me just give you a brief overview about it before we start that. In a normal person, like in you and me, right, considering ourselves, we have a normal healthy persons. So in the normal turnover rate of our skin, right, is about 56 to 72 days. All right, so that is almost about more or less 2 to 2.5 months. Yes, we get a nice fresh layer of the skin, right? But in these patients, this process happens very quickly, right? So in psoriasis, the turnover rate is 4 days. These patients get new skin. So just imagine the amount of dryness they would be having, because every 4 days they're getting new skin, right? It's not that they're getting extremely nice glow on the face or something, right? But still, that is the whole thing about that. There is mayhem in these patients, right? So let us continue as you have the overview about this, right? So I hope the classification helped us. Yes, that is very important. And please do remember the images as well. Alright, so derma is all about images and how well we can talk about particular image. Alright, so let us continue. This is about yes, for sure, this is an autoimmune condition, inflammatory skin reactions. We repeated this point multiple times. Alright, the next one is why is it actually happening, right? Dysregulation of the immune system to the skin, leading to hyperproliferation of the cells, right? That would be the answer over here. Hyperproliferation. Hyperproliferation of cells of the epidermal layer. Alright, so that is about the definition. Yes, and this point we just discussed that the epidermal turnover rate is normally about 56 to 72. Yes, in the normal person, and in somebody who has psoriasis, it is as severe as 4 days, right? Yes, 4 days. Yes, and there are some infections associated with it. Yes, so one of it is HIV. Yes, and the next one is streptococcal pharyngitis. Okay, all right, and this infection is also associated with the guttate psoriasis, right? The guttate one, try to recall, where did we use the word guttate? Guttate was where there was raindrop lesions, right? We also saw an image, there were raindrop lesions on the whole body, right? So this is streptococcal pharyngitis. streptococcal pharyngitis. All right. Okay. And yes, this is as we just spoke about it, that streptococcal pharyngitis is also associated with guttate psoriasis. All right. So last time, let us go back to this and we just see this as well. All right. This was the guttate psoriasis, the raindrop lesions. Okay. All right. So we go on to the next one, that now we know about the whole disease, why is it happening, we have learned the classification, now we know everything about it. The next step would be, how would we manage this patient and what would be the actual plan of action when we have a patient suffering from psoriasis, right? So first of all, the mainstay of the treatment is going to be how pronounced the disease is, right? So if it is a very mild one, what are we going to do? If it is very severe one, what are we going to do? If it is more severe, what are we going to do, right? So that is about the next thing. Yes. And before that, let us see the presentation. This is for sure we have scaling. Yes. And the most common as we just saw in the images as well, right? So most common we have on the extensor surfaces, that is the vulgaris form we read about. It was on most commonly on the extensor surfaces. Extensor surfaces of the elbows and knees. All right, so that is that. Yeah. And definitely we can have joint pain, joint swelling will be there. Pruritus is a key finding, and conjunctivitis and blepharitis, that is the inflammation of the eyelids, right? And the next point is pretty interesting. Yes, so in some psoriasis we have increased uric acid concentration. Yes, increase in uric acid. So it is pretty obvious that there is only one psoriasis where we can find this condition, right? That is increased uric acid. All right, in the ESR, some of the findings would be either it would be normal or it would be increased. Yes, it is normal or either it is increased. All right, the ESR findings are increased in the two conditions. Yes, this is pointing towards here, right? In the erythrodermic psoriasis and the pustular psoriasis, we would have increased ESR count, that there is inflammation is there in the body. All right, so that was supposed to be the next question, but okay, fine. Physical examination, what are we going to find, right? So in the vulgaris form, we're going to find on the extensor surfaces, right? As we can see in this image, the word is very peculiar, that there is salmon patch. When we have salmon, like very fresh pink salmon, yes, in this as well we see. Let me just write that point. On physical examination, we would have salmon patch appearance. Salmon patch, right? We would have on the extensor surfaces, right, of the elbows and knees. Okay. All right. How about the diagnosis? Yes, for sure it's going to be just as a clinical finding, right? Because there are so many things pointing it out towards this. But if there are some sort of pustules, we would like to take a biopsy and see then. Okay. So the next one, the treatment aspect, right? So what treatment we can provide to the patient, right? First of all, before starting on to what actual thing we can give, so first we have to understand the approach, right? What's going to be the mainstay of the treatment. All right, so if anybody is suffering from mild psoriasis, I don't need to use like the extreme firepower which I have. Yes, I don't need to use that. So we can just go on with some topical corticosteroids. Yes, so let us write mild psoriasis, we can use topical corticosteroids. So we can use that. And in the moderate to severe form, right? So what are we going to use? Yes, in the severe form, definitely we have to use the systemic drugs we have to use, and we can also use phototherapy. All right, we can use systemic and we can use phototherapy. Alright, so in phototherapy, definitely we have the UV light exposure, and we can use narrowband UVB light, yes, for the patients. And for the systemic, we have to use immunosuppressant drugs and oral retinoids we can use. Alright, and if there is psoriatic arthritis, and we have to give systemic drugs for sure, right? Let me just write that. We have to use systemic drugs, systemic involvement we have to give. Alright, what drug we can offer to the patient, right? That is important. One of the main drug, like the highlight drug, right, for arthritis is methotrexate. Yes, methotrexate. Methotrexate. Alright, fine. Methotrexate, or we can give the TNF inhibitors, right? Adalimumab and certolizumab, right? These two drugs we can give to the patient, right? So this was all about the mainstay of the treatment. Yes, so what condition, if there is mild, moderate, severe or arthritic psoriasis, what we're gonna give, right? So that's there. And now let us discuss more about the treatment, right? So first of all, we have to see the responsiveness of the patient, how well the patient is responding to our treatment. Yes, that is one thing, the responsiveness to the treatment, and also depends on the severity of the lesions, right, as we discussed earlier as well. Okay, and so what do we have to offer to the patient initially? The treatment, more or less in dermatology, is more or less the same, right? So we have to offer the corticosteroids. Yes, we have to offer corticosteroids, and we can offer retinoids. Yes, right, retinoids to the patient, and we have to offer the vitamin D. Vitamin D can help us. Alright, vitamin D, anthralin is also used. Yes, yes, but the last point in the treatment aspect is whenever there is an excessive of flare up, right, so we have to use a cyclosporin, right? That is very important. Yes, this is an important point. Cyclosporin has to be given. Alright, so that was all about the psoriasis. Alright, so let me just give you a very quick overview, very quick revision let us do for psoriasis topic, as this topic is very important. Yes, so first of all we started with, alright, first of all we started with the discussion just related to the classification, right? First of all we did pustular psoriasis, right? Pustular psoriasis had two types. One was localized one and one was a generalized type, right? Generalized type, the fancy word was, hot word was the 𝗲𝗵𝗵𝗺, right? Whole body we have that. And the next one we had the plaque psoriasis, right? And in the plaque we had acute guttate psoriasis, the raindrop lesions. Yes, this was associated with one bacterial infection, that was streptococcal pharyngitis. Alright, so that is there. And in this we have the ESR is elevated, right? That was one point from the presenting features as well. Alright, so the next one we had the chronic plaque psoriasis, that was there. Alright, which had on the extensor surfaces. The next one was inverse psoriasis, right? On the flexular surfaces we saw the image as well. And on the right side we had the most dangerous one, the erythematous psoriasis, the only emergency in the whole dermatology. And the next one we had the nail psoriasis, yes, followed by psoriatic arthritis. Alright, that is one thing. So that is all of the whole classification about. Then we went ahead with the treatment, how the patient presents to us, and what treatment we have to offer. Basically we just have a topical or systemic things. This is very basic, right? So, and we also have for the moderate severity patients, we have either systemic or the phototherapy. In phototherapy we can give the UVB rays, yes, and followed by the treatment options we have. Basically we can give corticosteroids, we have to give them the vitamin D, yes, and the retinoid cream. Yes, so I guess that was all about psoriasis. This is a pretty interesting, pretty important topic related to this. I hope I made some justice to it. Make sure that this table, this whole classification is very clear in our head, right? And why does it happen? There is hyperproliferation of cells. Why do we have there is the layer of epidermis, right? It is being shed off very fast. With just turnover rate is 4 days. Yes, so if we just remember the highlight things, it will be very easy for us, right, to just remember this one hot topic from dermatology. Alright, so thank you so much for listening.